And happy Monday, everyone. Thanks for joining us as we begin a new week and once again focus on the continued flattening of the COVID-19 curve here in Orange County. The discussion this afternoon will include information on new testing sites in Orange County. Mayor Demings and Dr. Pino, the director of the Florida Department of Health here in Orange County, will talk about and focus on these sites. We know that Mayor Dyer will not be able to make it with us this afternoon. He had an extensive city council meeting. But we have a Dr. Barbara Jenkins, the Orange County Public Schools Superintendent, who will bring information on graduation and other important end-of-the-year details. Thank you for being here, Dr. Jenkins. We begin first with Orange County Mayor Demings, who at the end of his remarks will share a very special video of a very special young lady on a very important topic. We begin with Mayor Demings. Mayor?
Good afternoon to all of you. Thank you once again for being here. This week, we will have three primary focus areas as we move forward. The first area that we will focus on is really doing more testing within Orange County this week. Secondly is preparing the community for business reopenings. And thirdly, to prepare Orange County for its public building reopenings as well. So at the end of this week, we hope to have developed more specific plans about how we address all of those particular issues. As we come today to give you the update on just where we are with the COVID-19 pandemic here within Orange County, we have to talk a little bit about the backdrop of what's going on in the world around us. The Centers for Disease Control now says the number of people confirmed to have contracted the coronavirus in the United States is approaching 1 million people. The national death toll is at over 52,000 individuals. In Orange County, we have a total of 1,339 cases with 30 deaths. The median age range of those who have tested positive here within this community is 45 years old. We have tested some 23,600 plus individuals since we began testing several weeks ago. Dr. Pino will certainly give you more information about the data that's being collected by the Department of Health. I want to announce the opening of two new mobile temporary testing sites in two of our hot zones, and we always bring the maps in just to give you a visual of just how we're doing as a county. They will be run by the Orange County Health Services Department and will be open for 3 days this week, starting Wednesday, April the 29th, and running through Friday, May 1st. In the 32824 hot zone, there will be a testing site at the South Orange Youth Complex in the South Chase area. The address is 11,800 South Orange Avenue, 11,800 South Orange Avenue. The second site will be at the Ventura Elementary School. We thank the Orange County Public Schools and Dr. Jenkins for assisting us with the testing site. That location will assist us in addressing the cases in the 32822 zone, but it will also help us throughout that entire area. The Ventura Elementary School is located at 4400 Woodgate Boulevard, 4400 Woodgate Boulevard. Both testing sites will be open from 9 a.m. to 4 p.m. 150 tests will be administered each day. It is free for anyone 18 years of age or older, and there is an appointment, however, that is needed. You can go to our website at ocfl.net/coronavirus to make an appointment. If you speak Spanish or Creole, you can actually call our 311 hotline. We have translators who are there that speak those languages. Again, these sites will open from Wednesday through Friday of this week. Tomorrow afternoon, the entire Orange County Economic Recovery Task Force will be meeting for the second time. The task force is charged with developing a phased approach to reopening businesses that balances the lives of employees and residents while preserving the economic livelihood of our community. The meeting will be carried live on Orange TV from 2:30 p.m. until 4 p.m. tomorrow. Let me talk a little bit about what we're doing to distribute hand sanitizers within our community. Last week, Orange County Fire Rescue received a shipment of over 3,000 travel-size bottles of hand sanitizer. 2,000 of the bottles were taken to all 42 of our fire stations, and they're being handed out to residents on each call that the fire department or EMS responds to. 1,000 bottles are being distributed this week at all Orange County testing sites by the Department of Health and County Medical Services. We have been trying to drive home the point that we all must continue best practices, including hand washing, wearing a mask, and social distancing. Speaking of hand washing, I want to share with you an informative video from one of our youngest residents. At our Bithlow Head Start program, a class recently read a book called Germs Are Not for Sharing. Germs Are Not for Sharing. As part of an assignment, the teacher asked the students to come up with a video showing the proper way to wash their hands while reciting their ABCs. Young Anaya Mendez took the assignment to heart and, along with her parents, created this wonderful video that you're about to see. We're going to show it to you now.
Hi guys, my name is Anaya, and this is how you protect yourself from the germs. Ew, on our doorknobs? There are germs everywhere, even on your fridge. Ew, look at these germs. The only way to keep your hands clean is hand soap. Hand soap keeps the germs away. And one pump, A, B, C, D, E, F, G, H, I, J, K, L, M, N, O, P, Q, R, S, T, U, V, W, X, Y, and Z. Now I know my ABCs. Next time, won't you sing with me? A, B, C, D, E, F, G, H, I, J, K, L, M, N, O, P. I hope you guys like my video and stay germ-free.
We're very proud of her, and I know that she has a bright future, perhaps as an actor, but I know she got a good grade on that project as well. So I thought we would just share with you just how, from the youngest in our community to those who are older, how they are indeed taking it to heart in terms of the social distancing and embodying all of those hand sanitizing protocols that have been put in place. So with that, I'm going to turn it over to Dr. Pino at this time.
Thank you, Mayor. I think Anaya is going to be a surgeon. She washed her hands very well. She did her homework. So good afternoon. Orange County has, as the mayor indicated before, 1,339 positive cases. And a new number that we are going to start offering to you is that, and this will improve our ability to provide this number, is about 70% of all our cases have recovered so far. We have a 5.7 positivity rate, which continues to decline. This is the number of positive tests that come back from our testing sites. Last Wednesday, we have about 7%, and it has been in the single digits for over 2 weeks. We have tested over 23,000 individuals. We have 30 deaths, unfortunately. A new person was added to our list of people who had poor health outcomes, and our condolences and thoughts are with her family. She is a 77-year-old female with underlying conditions, and we know that the contact was with a previous positive known COVID person. And we continue to insist it is critical, important that we protect people who are elderly with pre-existing conditions, and no measure that we take to prevent this will be enough. We really, really have to try to protect even our own family members in our own family structure. Should be isolated as much as we can from the rest of the family to prevent them from contracting this disease, which seems to be affecting people who are over 65 years old with pre-existing condition even harder. With regard to last week testing, we have a good number of tests that have been conducted. On Monday, we had our final count, official count is 162. One positive, new positive, that person is. And the percentage of positivity rate that day was 0.6. On Tuesday, we tested 218 individuals, 3 positive. Those 3 were known to us, so really no new positive that day. Wednesday, on the 22nd in Camping World Stadium, we tested 364 individuals, 10 were positive, 1 previous report, 9 newly diagnosed, for a positivity rate of about 2.7%. And on Thursday, we tested 395 individuals, 4 positive, and 2 of those were newly diagnosed. For the total last week, we tested 1,125 individuals, 18 positive cases, 2 of those were new. For the total week, we have a 1.6 positivity rate. For this week, on Tuesday, we will be at Apaca High School. So far, we have 318 slots already reserved for tomorrow. On Wednesday, 29th, we will be at Camping World. We have 162, so we still have capacity for close to another 150 individuals for Wednesday. Barnett Park has already 118 reservations, so we have some room there, as well as for Blanchard Park, which we have 105 already reserved. I remind people that to make an appointment with us, you should call 407-723-5004. We put a press release out this morning because we had some situation with the calls. I have taken some steps to fix that. So what happened was that part of what had happened is that our volume of call has reduced over the weeks. So we reduced the staff in the calling center by 5 individuals. So that was a factor. The other factor was that our system allow us to have 180 calls at any time, at the same time, coming in and out. And today we receive 2,350 calls and then overwhelmed our system. We normally, in the busiest day of the couple of weeks ago, we got to 1,000. We doubled the number of calls today. So it crashed the phone system. So we quickly got into work with the contractor and increased the number of lines from 180 coming in and out to 580. We also increased the staffing by 8 people in the calling center, and we will extend even more tomorrow. So we are recalling people who are working from home, teleworking, to be able to accomplish this. And we also created a mailbox where people, instead of waiting during the week, they can call, leave the name, the phone number, and we will call them back. The same process that we use for the weekends. And I also placed the calling center under the supervision of one of my direct reports, so that I have direct contact with the calling center at every time. We also are engaging with the assisted living facilities and long-term care facilities with a project in coordination with the State Department of Health, the Governor's Office, and the National Guard, where 5 facilities, and this is voluntarily, and we would like to increase that number. We will test every employee and every member voluntarily, if they agree, that are residents of the facilities. So it's more like a sentinel project, and we would like to see where the pandemic is in our most vulnerable residents. So it's reasonable to expect that we are going to find a few asymptomatic individuals, either workers or residents in this group, so those numbers could go up next week, but it will be a result of activity. And part of the ability to go back to normal is our ability to monitor these institutions and these places where we can have outbreaks. Just another detail that indicates that we are in a deceleration, a sustained deceleration of the pandemic, is that over the last 2 weeks, we only have single-digit hospitalizations per day. In the last 2 weeks, we never had more than 4 hospitalizations in a day. So that's one of the other measures that we are looking as an indicator when we and with the county engage in reopening our economic activity. With that, and I will answer any questions after this phase of the press conference done, I would like to hand on the microphone to Dr. Jenkins, the superintendent of Orlando Public Schools.
Thank you, Dr. Orange County Public Schools. Thank you, Dr. Pino. A few things I would like to share on behalf of our school board and my administration. Of course, we've always said we have 2 priorities, that is continuing to educate our 212,000 students and providing meals for those children who are most in need. So our distance learning will continue. I have to remind individuals, especially our students, including the grandchildren of the mayor, that we still have 4 weeks of school left. Essentially, May 27th is the last day of school. So we're encouraging parents and students to finish strong. Secondly, we did finalize our graduation plans on Friday for our students who are just in such anxiety over how they were going to celebrate 12 years of education. Unfortunately, we don't have the capacity at this time to do an in-person graduation ceremony, so we will be doing virtual graduations for each of our 20 high schools. All of those details are going out to seniors and to their families through the high school principals at each site. We have also set aside time in July for in-person graduation ceremonies at the high school football stadiums. I made it very clear to our students and families that that is probably not likely. However, we will have plans in place just in case we are at that level of clearance toward the end of July. This does 2 things. It helps those students who need closure because they have plans for the summer and moving on with college or higher ed or employment. They can have closure at the completion the first week in June when we do those virtual graduations. And those who want the in-person ceremony still have some hope that that might be a possibility as well. We are finalizing our plans for summer school as well. Those students who need course recovery or those students who have had some struggles at the elementary level will have summer school provided during the month of June. It will be virtual as well. All of those plans are forthcoming. I want to say again, we understand how difficult and challenging this has been both for families and for teachers and for principals and assistant principals, but I want to thank all of those groups for helping make sure we continue to lead our students to success. So for teachers, for their tireless effort, for parents and families who are at home dealing with that distance learning, we want to commend them as well and ask them to just hang in there 4 more weeks until the end of the school year. I also want to thank our food nutrition services workers who are helping make sure our children get their meals that they would normally receive if they were in school. And then finally, I want to thank all of OCPS employees who are continuing to do their work at home, that a major corporation can continue its business because of so many folks both coming in to the offices on Mondays, Wednesdays, and Fridays from 9 to 2, and those who are working at home in the intervening times as well. Let me give you a few more details about distance learning. Over 1 million logins to our learning platform, 1.8 million assignments uploaded to that platform, yet we still know we have a few children who are missing in action. And so I want to share, if you know anyone who has not had contact with their teacher or with their school, that means we are desperately trying to reach them. And so it could be a new phone number, it could be that they've relocated. Anyone who's not had contact from their school or from their teacher means that we are desperately trying to contact them. If you know of anyone or if you happen to be in that category, we ask you to please contact your local school. We also have 4th and 5th graders. If you recall, over 140,000 laptops were already in the possession of our secondary students, and then we started distribution to our elementary age students, particularly to schools where we have children with no connectivity in the 4th and 5th grade. So an additional 2,457 laptops have been distributed to those students as well. When it comes to our grab-and-go meals, 1.6 million have been distributed to 600,000 students across the school district. We do Monday, Wednesday, and Friday distribution, so students have their meal for the second day when they come on those particular days. And on Friday, they have additional meals provided for the weekend. Just a reminder, meals are provided for those students in need and families in need. Even if you were not a part of free and reduced lunch, if you are in need, you are welcome to come to our feeding sites. We understand the economic impact of unemployment has hit so many of our families. We want to welcome them to participate. Any family, students who are struggling to make ends meet are welcome to those meals. I want to remind everyone, our office hours are Monday, Wednesday, and Friday from 9 a.m. to 2 p.m. That does not mean our work hours are that contracted. It means that's when you can see someone in person by appointment at any school office or at the Ed Center office by appointment. Other hours, calls are being answered and matters dealt with, emails answered from remote locations. A large majority of our 25,000 employees are working at home. And then since Chief Mina's not here, I know he will appreciate me reminding everyone, just because we have limited office hours, our schools are monitored 24/7. So we've had a few visitors on campus who didn't take us seriously, and they have been apprehended. We have both auditory monitoring and visual monitoring of all of our school sites. They are closely watched to protect taxpayer assets, because when our children return, they need all of their belongings to still be in place. And then let me say something briefly about closing. As we approach that 4-week mark, lots of people are concerned about, how do I retrieve my child's belongings? He left some things in his locker, in his desk, in his classroom. We promise you we have plans being made with our safety and emergency management staff to make that a very organized and safe process, because everyone cannot show up to the school with our social distancing and CDC guidelines in place, cannot show up to the school at once to retrieve their belongings. Those plans are being prepared, and it will be an elongated process, both for teachers to retrieve their personal belongings and for students to retrieve their belongings, teacher assistants, any employees. So if you will wait, each school will be communicating how you get your personal belongings. Please do not call the school or show up at the school because you want to get some of your belongings now that school has been closed for the remainder of the school year. We have a plan, we have a process, and that will be communicated out to each of you. Lastly, let me encourage you to click on the OCPS website. We've got a health advisory link, we've got Facebook, we've got Twitter. We will keep you informed as regularly as possible concerning any changes. And I would be remiss if I didn't remind folks to comply with our census effort, because those census surveys, that information is going to help impact our entire community, and certainly our schools get the assistance that they need based on accurate census information. So if you haven't dealt with your census survey, please take care of that as well. Thank you very much. Mayor?
Thank you, Dr. Jenkins, and let me also just recognize two of our Orange County commissioners. Commissioner Mara Uribe is here, and Commissioner Gomez Cordero. Momentarily, we will And Commissioner Moore. We have three here today. So when we conclude the main portion of the press briefing today in English, we will do a briefing in Spanish, and so I'm going to invite them to come up at that time. But up to that point, we'll open it up for questions, and I also want to recognize the executive director from the Orlando International Airport, Mr. Phil Brown, is here. So if you have any questions, remember how we do this. If you have questions for myself or any of the other participants, we'll try to ask all those questions while that person is standing here at the microphone, and then we'll pass it off to one another as we move forward. So any questions?
Lauren Seabrook, Channel 9. Mayor, first question for you. I've been hearing from some folks that they're receiving emails from businesses, like a gym, for example, saying that they plan to reopen on Saturday, given that the stay-at-home order is finalized, I guess, Friday. Do you have any message for those folks, given that there's no new date for reopening at this point?
At this point, we are still under the mandate of the governor's executive order, which obviously shutters certain businesses that have been deemed to be non-essential. That order goes until April the 30th. We are awaiting direction from the governor whether or not he will extend that order or not, or modify it. And so hopefully we will get that within the next day or so. And so until that time, we are still under the order. In terms of the curfew that is in place, that curfew still remains in place nightly, of course, until between 11 p.m. and 5 a.m. in the morning. It remains in place. So much of this will be better defined within the next 24 hours, I believe.
Okay. My second question is for Dr. Pino. Can you tell us about the process for notifying the folks who have come to these mobile testing sites, whether they're positive or negative? The reason I ask is we've heard from some folks who heard on the media, from the media, that there was a positive case, in that first one on Monday, and then, they'll be hearing now from these cases that there's positive cases. They are wondering if they're the positive cases if they haven't heard yet, and they're kind of upset to hear it on the media first.
Yeah. We hope that this is not the first time they heard. We normally, all the positive cases will be called by our staff to do what is called contact and trace investigation. Then where we will have a conversation with them and explore onset of symptoms, who they were in contact with, and the time frame of the infectious period, and how can we capture who they could have been in contact with. So all of them should be contacted. But besides that, also when everyone goes to the testing site, they receive a sheet with information with an app from the lab that they can self-check their results within 24 hours. So that is, both are in place. And we will concentrate our efforts in contacting the negative. The positive, which is our main effort in this case.
Hi, I'm Valerie Boyd, Fox 35. I have two questions. The first one is for Mayor Dennings. Could you please make a suggestion for all those people that want to get their haircuts done and other appointments, and for the stylists that are ready to take their appointments, what would be a safe time to start doing that? What date would you recommend?
That's very difficult to recommend a date by which they will take appointments, but let me just say this. The work of the Orange County Economic Recovery Task Force is moving forward. They will be meeting daily this week, trying to ensure that what guidelines we put in place here in Orange County also meshes with whatever the governor decides to do this week with his task force. So what I would suggest to people is to just remember that currently we remain under the order that I referenced earlier. Going forward, we do anticipate that there will be a phased reopening, and what I would suggest to them that they wait until they hear that direction. Our goal this week is to, by the end of Friday, have a more specific direction about when the various types of businesses may be able to reopen. And so they really should wait on that, but I understand that many businesses just want to reopen, get back at it, but they do so at some risk there because we do intend to enforce whatever orders will be in place.
And then the second question is for Phil Brown.
Phil Brown?
Where are you at?
Okay,
Oh, there
give
you
him
are.
Just a moment, he'll come forward from the airport. As he's coming forward, any other questions of me before we go forward? Okay. All right. Mr. Brown? Sir.
Hi, Mr. Brown. So there's a few things. I'm being told that the increase of the homeless people staying at the airport, there's more of an increased population. Can you tell us if that's so? And also, what's being done? I'm told that there's more than 14 TSA agents now that have tested positive. What are you guys doing?
Well, let's talk about the unsheltered. As far as we can tell, there's no increase in unsheltered, but by comparison, the terminal's pretty empty, so if they're there, they seem like they're largest. But we have not had any indication that the unsheltered are staying in more numbers at the airport. With regard to the TSA officers, I was told this morning that of the 14 that have tested positive, 7 have returned to work, and 2 more are scheduled this week to return to work. Beyond that, I don't have any more data. We're actually going through and making requests of the various employers at the airport who've had positive tests to see what the status of their employees are with regard to those tests, and we'll have more later this week on that.
Hi, Eric Sandoval with News 6. First question for Mayor Demings, real quick. I just want to clarify. The Orange County Economic Task Force will be meeting daily this week, every day?
Yes.
Okay.
We have a published schedule of the meetings, and as I referenced earlier, they will be streamed live on Orange TV as well. So we hope that our citizens have the opportunity to engage that way as well.
Absolutely.
Okay.
My next, go ahead. Did you have something else? Sorry, I'm hearing things now. Dr. Pino, my next question is for you. We've talked about this before, but can you talk about how difficult it was to find places within 32822, 32824, and why it took so long to get those testing sites established?
So we needed to speed up the process, and the mayor gave us the directive of increasing testing rather quick. So with the type of equipment that we move, and that you probably some of you have seen at the sites, there are some risks associated for whoever is hosting us. So normally, if we do in a private facility, we will have to engage in a contract, meaning who is going to be responsible for someone tripping, all the small details that go into a contract that unfortunately have not been voided during this crisis. We still have to adhere to that. And so in interest of speeding the process, we selected town or county properties where we can share the risk without going through any processes. Now, the other element that we have to do with that is because we are taking 300 cars a day, we need a space to be able to have a line if the line forms. And how disruptive, because we are going inside the communities, how can we be the least disruptive possible to having 300 cars coming into a community from many places? So those were the factors that we considered for our first round.
I would add to some of the sites that are being opened this week are going to be staffed by Orange County medical personnel directly. And we had a limitation of collection kits. So that limited the total number of sites. I'm happy to report that over the weekend we did receive a supply of additional collection kits from the state of Florida that really allows us to sustain doing multiple testing sites. And so this week we have increased our ability to test both with those that are operated and managed, if you will, through the State Department of Health, those which are being operated by the county, Orange County itself, and then we still have the location at the convention center where tests are being offered, and then we have some private sector testing sites that are being administered by Advent Health. So with all of that happening here, we have been able to really increase perhaps threefold the number of tests that we are capable of doing now within Orange County. Okay. Other questions?
Buenas tardes, Félix Pirela de Telemundo. Doctor Piro, tengo dos preguntas. La primera es para que nos dé detalle en español para nuestra comunidad latina de acá. Esta semana ya anunciaron que van a abrir 2 centros móviles y ya se están acercando un poco más a específicamente a los códigos más afectados, a las zonas más calientes, que la mayoría son comunidades hispanas, para que nos dé detalles de eso, dónde estarán ubicados, cómo van a funcionar y cuáles son los requerimientos que ustedes van a solicitar para que las personas puedan hacer sus pruebas.
Esa pregunta mejor la puede responder el alcalde porque son sitios que está poniendo el condado, no el estado. Y yo puedo traducir para él. Do you want to come answer the question because it's about the new testing sites and we translate for you.
Okay.
They are asking the specific about the new testing sites
Okay.
in those 2 zip codes.
All right, so I'm going to talk in English and then Spanish. No, it'll just be in English for me. Okay, what was the question?
The question was, what are the requirements for the new testing sites that the county is opening inside the communities? And how people are going to make their appointments and how many tests will be done per day?
Okay, so earlier I talked about the fact that the testing sites will be available to anyone who desires to be tested. However, we do want an appointment to be made, and that appointment can be made through the ocfl.net/coronavirus, or if you call the 311, if you don't have the ability to access the web, if you call 311 here within this county, you have to be within the county. Oh, sorry.
So I'm going to try. A cualquier persona que se quiera hacer las pruebas, se puede hacer las pruebas en los sitios del condado, va a tener abiertos a partir del miércoles, al menos por 3 días. No hay requerimientos, solamente que las personas sean mayores de 18 años. Para hacer una cita pueden visitar el sitio de la página de la internet del condado o también pueden llamar al 311 para reservar en estos sitios que el condado está poniendo.
La segunda pregunta es, la semana pasada, en los 4 días que hicieron pruebas en los sitios móviles, en estas cientos de pruebas que hicieron, solamente salieron 18 casos positivos. ¿Esto es un paso adelante para quizás reabrir la economía pronto, doctor?
Well, it's a good sign. Es una buena señal. Es una buena señal de que incluso cuando estamos tratando de buscarlo y lo estamos activamente buscando el virus, no estamos encontrándolo en números muy grandes. No es el único elemento, hay otros elementos que también di, el número de hospitalizaciones, el número de casos que están viniendo positivos y el número de muertes que también tenemos que tomar en consideración. La pregunta en español, the question in Spanish was, are the number of cases so low in last week? Is this one of the indicators that we will use to open the economy? The answer was, well, it's one of the indicators that we are looking at it, and I think it's a good sign that even when we are going after the virus, actively looking, not only patients coming to us that feel sick, and that's the difference. You know, when you feel sick, you look for help. You look for a hospital, you look for a doctor. We are going after people who are not even feeling sick, and we are now finding large numbers. So it is a good sign. It's one element to consider.
And I didn't say it, but the individuals who sign up to be tested, they must be 18 years of age.
I did say.
You did say, okay.
De la Riva con el periódico La Prensa para el doctor Pino en español. Doctor Pino, usted ha dicho que hay una tendencia a la baja de los contagios. ¿Qué pasa con este epicentro de los hispanos, que es el 32822? También está bajando los contagios y tiene alguna cifra de cuántos fallecidos en este zip code, por favor.
Sí, no tengo cifras de fallecidos por zip code y sería fácil de obtener, no es que no lo tengamos, es que cuando los números son tan pequeños, porque tenemos 50 y pico de de zip codes en el county y nada más tenemos 30 fallecidos. Si identifico una o dos personas por zip code, se puede fácilmente determinar, un vecino podría fácilmente determinar quién es la persona que ha fallecido y por eso estamos entonces violando la privacidad. Claro, existe el elemento, tú puedes decirme, cualquiera que vive en el barrio sabe cuál es la noticia, pero hay una gran diferencia entre saber la noticia y que sea el Departamento de Salud el que dé la noticia. Entonces, por eso somos muy cuidadosos. Con respecto a los números están disminuyendo en todas partes, pero voy a analizar, no lo sé en estos momentos de memoria, voy a pedir que hagan el análisis, a ver cuáles son los zip codes que han disminuido más intensamente. Podemos hacer ese análisis.
Y mi otra pregunta es acerca si reabrieran la economía, ustedes tienen un sistema de pruebas, rastreo y tratamiento en caso de que haya un brote en ciertas zonas. ¿Ustedes están preparados para eso?
Esa es una muy buena pregunta. Y esa es la pregunta de los $64,000. The question in English was, are we prepared? Do we have a surveillance system in place that will guarantee that if the economy opens, we have the ability to track and trace every case or every contact? La respuesta a eso es, tenemos un sistema rudimentario que hemos comenzado a poner en lugar. Claro, nosotros tenemos mucha experiencia siguiendo otras enfermedades, tuberculosis, HIV, cualquier enfermedad infecciosa de la que tú puedas hablar, tenemos mucha experiencia. Lo que pasa con este virus que lo dificulta es el hecho de que la transmisión es tan alta que los números explotan y no tenemos la habilidad de hacer el tracking que se necesita. Por eso es importante estar seguro cuando la economía se abra que los números estén en el nivel más bajo posible de manera que podamos controlar la posible transmisión en brotes que salgan. The answer in English to that question was, I say it was a very good question. It's probably the critical question is, do we have a system in place to be able to track? And my answer was that we had experience with HIV, TB, and other infectious diseases that we can gradually apply to COVID-19. The issue with COVID-19 is that it's so infectious that the numbers grow so quickly that it overwhelms our ability to do that part of the work, which is very time-consuming. And the numbers are coming at you more at a pace that you cannot keep up. That's why it's so critical to be sure that the numbers are to a lowest possible level before the economy start opening or reopening, so that we have the ability to assess any case that may come up in the community or any possible outbreaks and able to control. And that's going to be critical, not to have a second wave.
Okay. Yes.
Just have a couple more for everybody. This one for Dr. Pino from Alexa Lorenzo from WFTV. Has the recording on the hotline been fixed? Who is the third-party vendor you use? Are they responsible for helping fix the overload issue that occurred today?
So I don't know the name of the vendor, although it's in one of my emails, but I didn't memorize it, to be honest. And the Spanish recording was fixed as soon as we detected. And what was the third part of the question?
She asked, is the
Yes.
vendor the ones responsible for helping fix the overload issue
Yes.
that occurred today?
And they did. They are very responsive. It's also that we are not the only consumer that company has. And many health departments are also in the same situation. So, but yes, they have been very responsive.
This next one's for Dr. Jenkins from Eric Mock in News 13. He said that you are planning an in-person graduation ceremony for July, but that's unlikely it will happen. What specific factors will determine whether the ceremony goes through, and is there potential for an even later ceremony in regards to graduation?
So let me answer that in two parts. The sole controller of whether or not there is a July in-person graduation has to do with whether or not the state is reopened, whether or not CDC guidelines allow for gathering in large numbers. It's my understanding, even if we get to Tier 2, the recommended number would be 50, and that is not enough for a graduation. What we did do was leave the door open just in case everything is lifted that would allow for a large gathering of an entire graduating class in the football stadiums. We left that open because so many of our students desperately wanted that and our families wanted that, and so we are hopeful, but the reality is it's probably not likely. We wouldn't push it back further than that because then you are running into our efforts to try to reopen school in August. And so potentially that late July timeline is about as late as we would pretend to go.
And this last one is from Mayor Demings from Ryan Lynch with Orlando Business Journal. Has Orange County received any additional guidance from the state on reopening businesses? How might it proceed with tomorrow's task force meeting as it prepares to get that guidance?
Well, we were optimistic that we would have more guidance today, and unless it came in subsequent to the beginning of this press event, we haven't received it, but we remain optimistic again that perhaps we'll get more guidance tomorrow, and we'll go forward from there. Okay, if there are no more questions for this phase, we're going to kind of retool here with some additional staff that will come up, and we're going to do this portion of the briefing in Spanish. Thank you, Dr. Jenkins, for being here today. Good. Okay. Feel free to call on any of our commissioners. They're both fluent in Spanish. You want to say that in Spanish?
Oh, sorry. Blooper. No. Que se sientan en la libertad de hacerle preguntas a las comisionadas. Ellas ambas son bilingües y están disponibles para responder a sus preguntas.
And Ilia Torres is one of my special assistants, and she essentially works full-time ensuring that we communicate with the various Spanish-speaking organizations here within the community. Okay. There are 3 goals for this week, and what I try to do each week is establish goals for the week.
Tenemos 3 metas para esta semana. Ha sido mi práctica establecer metas de forma semanal.
Goal number 1 is to increase testing throughout the community.
La meta número 1 sería incrementar el número de pruebas realizadas en el condado.
Goal number 2 is to better define the process for reopening businesses.
La meta número 2 sería mejor definir las guías para reabrir las operaciones en el condado.
And goal number 3 is better defining reopening county services as well.
Y la tercera meta sería mejores directrices o directrices más definidas para reabrir las operaciones del condado como tal.
The CDC now says that the number of people confirmed to have contracted the coronavirus in the United States is approaching 1 million.
El CDC nos informa que a nivel nacional las estadísticas de las personas infectadas con COVID se acerca a la cifra de 1 millón de pacientes.
With a national death toll at over 52,000 individuals.
Con una cifra de muertes para 52,000 personas fallecidas.
In Orange County, we have a total of 1,339 positive cases.
En Orange County tenemos un total de 1,339 casos.
With 30 deaths.
30 muertes.
We have tested over 23,600 individuals.
Hemos realizado sobre 23,000 pruebas de detección de COVID en el condado.
We have depended upon the Florida Department of Health at Orange County and Dr. Pino to give the medical or health update.
Dependemos del Departamento de Salud de Florida y del Dr. Pino para proporcionar una actualización con relación al Departamento de Salud.
In terms of our goals for this week, I want to announce the opening of 2 new mobile temporary testing sites in 2 of our hot zones or communities.
Deseo anunciar la apertura de 2 centros móviles en las zonas de más alta incidencia de casos COVID en nuestro condado.
These 2 sites will be run by Orange County Health Services.
Estos 2 centros móviles serán operados por el Departamento de Servicios de Salud del condado,
Beginning this Wednesday, April 29th through Friday, May 1st.
comenzando este miércoles 29 de abril hasta el viernes 1 de mayo.
In the 32824 area, there will be a testing site at the South Orange Youth Complex in the South Chase area.
En el código postal 32824 tendremos un centro móvil en el Centro de Recreación para la Juventud, cuyo nombre es South Orange, ubica en el 11800 South Orange Avenue.
The second site will be at Ventura Elementary School.
El segundo centro ubicará en la Escuela Elemental Ventura.
It will be primarily established to assist those who live in the 32822 area code.
El centro se ha establecido primariamente para atender las necesidades de los que viven en el área code o código postal 32822.
The sites will be open between 9 a.m. and 4 p.m.
Los centros operarán en horario de 9 de la mañana a 4 de la tarde.
150 tests will be administered each day.
Un total de 150 pruebas serán administradas cada día.
It is free for anyone 18 or older,
Es gratuito para personas de 18 años o más,
but an appointment is needed.
pero requiere la coordinación de una cita previa.
You can make appointments through our website at ocfl.net/coronavirus.
Puede coordinar su cita en nuestra página web ocfl.net/coronavirus.
You may also call the 311 line for Spanish or Creole.
Si usted prefiere el idioma español o criollo haitiano, puede comunicarse al 311 para agendar su cita.
And tomorrow afternoon, the entire Orange County Economic Task Force will be meeting for the second time.
Mañana el Grupo de Trabajo de Recuperación Económica se reunirá por segunda vez.
The task force is in charge of developing a phased approach to reopening businesses.
El grupo de trabajo tiene la meta de desarrollar un plan por fases para reabrir las operaciones comerciales que tenga un balance entre la vida de nuestros empleados y los residentes y nuestra economía.
The meeting will be carried live on Orange TV from 2:30 p.m. until 4 p.m.
La reunión será transmitida en vivo a través de nuestro canal de televisión Orange TV de 2:30 a 4 de la tarde.
We received a shipment of over 3,000 travel-sized bottles of hand sanitizer.
Hemos recibido un cargamento de sobre 3,000 botellas de desinfectante de manos.
They are primarily being distributed by our fire department when they are out on calls for service.
Principalmente estamos distribuyendo estas botellas de desinfectante de manos por nuestro departamento de bomberos a medida que responden a las llamadas de asistencia.
1,000 of the bottles will be distributed this week at all of the testing sites.
Una cantidad de 1,000 botellas de desinfectante de manos serán distribuidas en nuestros centros de pruebas móviles.
And that provides the update generally that we presented today, other than the video that we showed earlier. And at this time, I'm going to invite our commissioners to come forward. One can go to that podium and one can come here if you have additional information that you'd like to share.
Gracias, señor alcalde. Gracias a todos ustedes por estar aquí. Unas cositas que quiero decirle, gracias a toda la prensa, ¿verdad?, que siempre están pendientes a todo lo que está pasando y para llevar la información en español. Quiero darle las gracias a él por el site, ¿verdad?, la localización que está en el 32824, ese es el distrito 4, donde queda el área de Meadowwood, Weatherby, South Chase y toda esa área de allá del sureste de Orlando. Y le doy las gracias por ese ¿verdad?, esfuerzo y por seguir, ¿verdad?, ayudar a la recomendación que le pedí. Una de las cosas que él dijo y que quiero volverle a hacer énfasis es el curfew, o sea, el estado de queda todavía está a las 11 de la noche hasta las 5 de la mañana y el sheriff la oficina del alguacil está bien en serio en que si usted no tiene que estar afuera, no esté. Por favor, vamos a seguir, ¿verdad?, las medidas. El alcalde también, yo sé que mucha gente me está preguntando cuándo va a abrir el condado, lo acaban de decir, él está esperando, ¿verdad?, una contestación concreta y exacta este viernes del gobierno, o sea, del gobernador, para ver en qué fase, cómo van a ser las fases y cómo es el proceso para abrir. Todo sea, ¿verdad?, para la seguridad y el bienestar de la comunidad. La superintendente de la escuela dijo que todavía, ¿verdad?, las clases se acaban en mayo 27 y todavía hay almuerzo y merienda para sus niños, lunes, miércoles y viernes. Por favor, vaya para que cojan, para que sus niños se puedan, ¿verdad?, puedan proveerles los alimentos. Y por favor, no olviden el censo. Mucha gente ha llamado, acuérdense que todo lo que se diga es confidencial. Nada de lo que usted ponga ahí se va a divulgar. Y como un ejemplo es, vamos a suponer que tenemos 20 estudiantes y solamente hay cabida para 10, porque esos otros 10 no fueron, ¿verdad?, registrados en el censo. Por favor, vamos a hacer el censo para hacernos contar. Dios me los bendiga y gracias por estar aquí.
Muchísimas gracias. Algo muy importante que tenemos hoy es que en los 2 zip codes que tenemos los casos más altos en el condado de Orange, ahora tenemos los análisis cerca. El 32822 y el 32824 en la Celia Park, es tan importante que le digamos a nuestra comunidad, vaya, hágase el análisis. Es un área muy fácil llegar por autobús, puedes ir caminando, puedes ir por carro. Pero la importancia es la parte económica. ¿Cómo vamos a abrir nuestras puertas de negocio si no sabemos cuántos casos positivos tengamos? Como decimos antes, si no tiene seguro, si no tiene documentos, no necesita el ID, por favor, preséntense. Porque, otra vez, es muy importante, hemos luchado las dos para que pongan un área específicamente donde pueden ayudar y es un gran apoyo del condado de ser estos 2 locales, porque así podemos adelantar. Por favor, manténganse en cuidado. Todavía tenemos casos saliendo positivos todos los días. Para poder controlar eso y abrir esta comunidad completamente se necesita. Hoy tuve una reunión con 11 compañías latinas aquí en el condado de Orange, donde están preocupados si van a poder salvar y salir de esta crisis económica. Y también estamos poniendo el esfuerzo que, por favor, tengan la información para aplicar para los beneficios de negocio, pero más de nada, transmitir la información en nuestra comunidad por iglesias, por grupos. El Padre José y yo vamos a ir al hogar en Alventura Elementary School a hacer un video para promover la comunidad en el idioma que entienden, que vengan y se hagan los análisis. Otra vez, hemos luchado por esto. Estamos garantizados miércoles, jueves y viernes. Y ojalá lo podemos seguir pasado eso. Pero otra vez, necesitamos que esto salga a nuestra comunidad, que por favor vayan y háganse el examen. Por esto va a abrir las puertas para la parte económica. Muchísimas gracias y una grande gracias al condado de Orange por asistirnos y apoyar nuestra comunidad en esto. Gracias.
Buenas tardes, comisionada Félix Pirela de Telemundo. Quisiera hacer una pregunta, pero que me respondan las dos. ¿Qué dicen las comunidades hispanas, que ustedes tienen contactos con ellas? ¿Están preparadas para reabrir la economía, tomando en cuenta que son las mayorías afectadas por esta pandemia acá en nuestra localidad? Y otra cosa también, la mayoría de las comunidades hispanas también le está pegando mucho el bolsillo porque muchos de ellos forman parte de los negocios no esenciales, como por ejemplo, trabajan en los centros comerciales, en los malls, en las barberías, las peluqueras. ¿Qué dice la gente? ¿Quiere volver a trabajar? ¿Quiere que se reabra la economía o tiene mucho miedo?
Bueno, con los negocios que hemos hablado hoy, están trabajando al 10%. Eso es muy bajo. Tuve un señor hoy que tenía 75 empleos, tiene 14. Otro que tenía 15 y tiene 2. Eso le está afectando mucho y no saben cómo van a salir de este estatus. A la misma vez, el Distrito 3 tiene los más empleos en la parte de turismo. Tenemos lo máximo gente que vive en nuestra comunidad. Quieren volver a trabajar. No saben cómo de serio todavía. Estamos hablando de esto todos los días para apoyar a la gente que tengan cuidado y apoyar a la gente que vayan y se hagan el examen. Pero yo creo que por mi parte, la gente quiere trabajar. Quieren que la economía se abra y tengamos más oportunidades. Porque no saben, ya llega el 1 de mayo el viernes y no saben cómo van a pagar mayo. Todavía están luchando para abril, imagínense mayo. Sí, ese esfuerzo está muy fuerte. En mi distrito que hemos escuchado, quieren volver a trabajar.
Yo he recibido muchas llamadas de barberos. Tú sabes que muchas de las barberías que hay, por lo menos en el área del Distrito 3 y el Distrito 4, son hispanas. Y ellos están locos por empezar. Y una de las cosas que ellos me han dicho es que hable con el mayor para que sean ellos en la fase 1, porque están locos por trabajar y abrir sus negocios porque no han podido pagar, ¿verdad?, la renta. Y muchos de los dueños, gracias a Dios, muchos de los dueños de los locales le han dejado pagar una mitad, ¿verdad?, mitad de la renta, y lo han dejado así por 2 meses que paguen la mitad, pero no están ingiriendo ningún ingreso. Pero una de las cosas que ya tienen, porque yo les pregunto si se abre, ¿qué van a hacer? Pues una de las cosas que ellos tienen es que van a hacerlo por cita, ¿verdad?, para que no se conflija mucha gente dentro. No van a dejar mucha gente entrar, van a usar guantes, van a pedirle que los que vengan tengan su máscara. Ellos van a tener su máscara y están pensando también tomarle la temperatura, que si están, ¿verdad?, ardiendo en fiebre o algo, pues no lo van a sentar en la silla y van a desinfectar la silla cada vez que pase, ¿verdad?, un cliente. Yo creo que ellos también están preparados para abrir rápido, porque acuérdense que ahora, como dijo la superintendente, vienen las escuelas, las graduaciones, aunque no se van a hacer, ¿verdad?, como van a ser virtual, pero como quiera, pues es un gasto. Y ahora vienen el verano, comida, no tienen suficiente comida. Yo creo que ellos ya están ready y quieren volver a trabajar.
Comisionada Maribel, sin embargo, todavía hay muchas personas que no se sienten seguras de que se reabran inclusive esos pequeños negocios. ¿Ustedes están aceptando sugerencias de todo el público y cuál es la confianza que le darían a estas personas que todavía se sienten inseguras de salir?
Muy buena pregunta, Rosana. Por eso el alcalde, él hizo el comité, ¿verdad?, de recuperación económica financiera del condado, y ellos son los que van a, ¿verdad?, a tomar como ser creativo en cuanto a cómo se puede abrir y qué pueden hacer los diferentes negocios, porque también tenemos los restaurantes que están, ¿verdad?, parcialmente cerrados porque están solamente haciendo delivery o pick-up. Y sí, miren, siéntense segura que todo el condado, todos nosotros, con el alcalde, con doctor Pino, estamos trabajando para la mejor y seguridad de ustedes. Y una de las cosas que dijo el alcalde la semana pasada, la voy a repetir ahora, que es que él no quiere tener una finanza saludable en el condado y un pueblo que no esté saludable. Para él, el pueblo es primero y la salud del pueblo es primero. Yo sé que se van a tomar las medidas necesarias. Gracias por
Y Roxana, yo también quiero poner ahí, los restaurantes que estuvimos hablando ahora están hablando de abrir afuera, tener las mesas más separadas y no todo adentro, y aceptando a la gente, porque eso es muy importante. Los negocios de restaurantes están sufriendo mucho, porque también cuando ponen el Uber Eats pierden el 30% de las ventas que tienen. No tienen el sueldo que está entrando, no tienen el dinero que está entrando. Quieren también en la fase primero si hay, no sabemos todavía del alcalde qué va a ser el plan, pero ellos están listos para hacer cualquier cosa que tienen que hacer para poder abrir.
Okay, I'm going to jump in because I wanted Dr. Pino to also provide an update to you in Spanish as well. So we inadvertently kind of skipped him, but
that's fine. Buenas tardes, mi gente. El alcalde estaba diciendo que me brincaron en el orden, pero está todo bien, no hay ningún problema. El condado tiene 1.339 personas que son positivas, como el alcalde dijo, y el porciento de resultados positivos que está regresando está en el 5.7%. Es uno de los puntos más bajos desde que comenzó la epidemia. Hemos tenido un total de 23.300 personas que se han hecho la prueba en el condado y hemos tenido 30 muertes. Una alerta a nuestra comunidad. Muchas de las últimas personas que han fallecido han sido en un porciento muy largo latinos. Es importante que, como vivimos, tenemos la costumbre, y es una buena costumbre, gracias a Dios es una buena costumbre, vivimos muchas generaciones en la misma familia, la mamá, la abuela, el papá, los niños. Es muy importante proteger a los abuelos, es muy importante proteger a las personas mayores de 65 años que tienen condiciones. preexistentes de salud, especialmente cardíacas, pulmonares y diabetes. Están afectando mucho a nuestras personas. En las pruebas que hicimos durante la semana pasada, solamente de un total de 1.125 pruebas, encontramos solamente 12 personas nuevos positivos, lo que nos da un % en la semana pasada de 1.6, y eso es muy bajo. El condado está en buenas condiciones. El condado está en buenas condiciones y debemos hacer todo lo posible en estos momentos por mantenerlo de esa manera. No es el momento de bajar la guardia, es el momento de intensificar la guardia, es el momento de tomar más medidas, es el momento de protegernos más. Y eso no está en contradicción con el hecho de que están pensando en abrir la economía. Las dos cosas pueden ir juntas. Para la semana esta que viene, esta que estamos ahora, mañana estaremos en Apaca High School, el viernes estaremos haciendo pruebas en Camping World Stadium, el jueves estaremos en Barnett Park y el viernes estaremos en J. Blanchard Park. Deben llamar al 407-723-5004 para hacer citas y todavía tenemos citas. Para mañana estamos a casi el tope con 318, pero siempre tomamos personas extra. Para el miércoles tenemos 162, tenemos como 150 disponibles. Para el jueves tenemos 118 en Barnett Park, tenemos casi 100 más disponibles, y lo mismo para Blanchard Park el viernes. Estamos aquí para servirlos. Otro de los números que estamos siguiendo muy de cerca es el número de hospitalizaciones, es decir, cuánta gente se está hospitalizando al día producto de COVID-19, y ese número ha bajado a menos de 3 personas en la última semana, y en los últimos 14 días no hemos tenido ningún día que haya sido más de dobles dígitos. Siempre 5, 4, 6, 3, 2, 1, 1, 1. Con eso, muchas gracias y responderé a cualquier pregunta que tengan que hacerme. El alcalde.
Okay. We have a few questions. Are they in Spanish?
No, this one is in English. Is that okay?
Yes.
My name is Dr. Rudolph Moise. I'm a Haitian-American physician. As you said earlier, Mayor, you're trying to open more sites. And I was wondering, it would be possible to open one close to the Haitian community. As you know, a lot of them are not working now, and they cannot afford to buy masks and gloves and everything else. And I think that maybe the parking lot of a church would be very, very easier for them to come in and test. So I was just wondering if that's a possibility.
Because of the mask, it was a little muffled, but I think I understood what you were saying about the Haitian community, Creole-speaking community. We have endeavored to translate any of our correspondence into different languages, and we post it on a regular basis through social media. So hopefully that information is being received in various places. And so we have been working with different community partners to also help us with sharing the information, such as the Haitian American Chamber of Commerce.
I was referring to the testing sites in the Haitian community.
Within the testing sites, they're in the various zip codes, and in the Pine Hills, Barnett Park area, we have testing sites that we tested in that area last week, and we will be testing again this week in that site. And we do have individuals who speak the language there as well. Okay. Okay, if there are no other questions, let me just say thank you to all of you for being here. Muchas gracias, and we will hopefully on Wednesday we'll come back and we'll do another press briefing. So thank you all very much.